Oh yes, we are back. Episode number 62 of the Daru Strong Podcast. I'm your host, Phil Daru. Today, I have the one and only Dr. David Abbasi. Now, Dr. David Abbasi has been the man behind my recreation of my ACL. He's the guy that did the surgery on my knee. So we're going to talk a bit about his journey now working with a lot of high-level MMA fighters, including guys that you've seen in the past when you're talking about UFC events. Also, we're going to talk a little bit about Conor's broken leg, and then we're going to talk more about how we can prevent that and working towards a greater goal to increase the stability of a person's career. All right, and then we talk a little bit about fighting in general. So stay tuned for that. Now, before we go on into deeper detail and get that conversation going, I have to shout out the sponsors. Check out vivobarefoot.com first and foremost. So that's the minimalistic shoe that I've been rocking inside my training, through my day-to-day, strengthening up my feet, getting full foot functionality, making sure that the intrinsic muscles of the foot are nice and stable so that I can produce force and just keep my body in a functional position as I'm walking or running. Now, also, got the apparel line out, Ironside Apparel / Daru Strong. If you guys want to rock some of the merch, it is online now. So go to darustrong.com and get you a shirt so you can rock it out and go ahead and represent fully. Now, also, if you're a coach that wants to learn some of the methods, the protocols, the principles of training that I use for my athletes and, of course, myself, you can check out the mentorship program. It's an online course where you go for 3 months straight, where you get full access to everything inside that portal. And on top of that, once you get a one-time fee, it's a one-time cost, and you get access for life. So every time I put something new up, you'll have access there for you. You get to hop on a weekly or bi-weekly call with me, going over any questions that you have for yourself. So again, huge opportunity for you to level up your game as a coach. I highly recommend it. Now, let's get on to the podcast.
Let's go. Mind over matter. Put your mind somewhere else and keep going. That little voice in your head is trying to stop you from getting to where you want to be. Be successful and keep moving forward. With your host and world-renowned strength and conditioning coach, Phil Daru.
Yeah, so I was there. I got in on Friday night. It was hot as shit. This is like.
Tell me so everybody's trying to get tickets to this.
Yeah.
So how did you get tickets?
Oh, Dustin gave it to me. Okay. But
so how many tickets do they get assigned? Because I heard even they didn't get as many tickets.
No, man. There was Donald Trump was there, man. Right. Like there's a lot of celebrities there.
Right.
Dustin asked me if I wanted to go, and since he asked me, usually I don't go. I kind of stay away from it.
Good card to go to.
Yeah, but like I'm over the fan type deal. I do it more for him as far as support.
Right.
Because after 2 weeks, then I'm done with him. You know what I mean? Like, it's really nothing else that I need to do. Eric took over his weight cut. So Pena, you remember Eric?
Yeah.
And so he took over his weight cut. So they were just working. And for that, I kind of try to stay out of it too much,
So when did he stop training in South Florida? When did he go to Vegas?
Stopped training that Friday and left on Sunday.
The week before
the fight. Yeah, usually they stay about a week because they have media obligations and stuff like that. So that, and especially if he's the main event, he has to go on like Sunday.
Right.
I think the undercard kind of gets there on Tuesday, but I'm not sure. But yeah, it was crazy. I got there. I didn't go for the whole entire card though. I got there right when Wonder Boy and Burns fought.
Wow, that's you were there for 2 fights.
Yeah. Well, here's the thing. One, my wife was there. Maria was there. Okay. So, I didn't want to leave her because she didn't have a ticket. We only could get one ticket. Right. So I was like, all right, I'm not gonna leave my wife. And then also
just hanging in the hotel.
Chilling in the hotel. She did a whole spa day though. Yeah. We were at the Aria. Yeah. She had her nails done. She got her hair done. So she was happy. Yeah. And so I watched the fight.
Sorry, wife, I'm going to the fights, man.
Yeah, but you see, that's the thing. Like I've been around it for so long.
Yeah, you're just you don't care as much.
It doesn't matter. I mean, I respect the fighters for sure, but at the end of the day, I'm not really wanting to. I was there to to help, to show support for Dustin. So I get there right about the same time that they were walking out, Wonder Boy and Burns.
Did you specifically want to be there for that fight?
No, I just wanted to get there in a timely fashion. Like obviously Burns is a friend, so I mean I wanted to be there.
Here.
Local guy, good guy, and then also I like Wonder Boy too. I like the way he fights, and we have mutual friends. So I was like, all right, let me go there, and I got in and. So my ticket was the H row, and it was it was section H, row A. So I'm right in the front. So I go there and I'm walking in the front, and like now you're on floor level. So there's a tape, and they cross the tape, and the guy reads the card or reads my ticket, and he goes, all right, well, you're all the way inside. And I'm like in seat 14. He's like, okay, you're in seat 5, so you can try your luck trying to get through all these people. Right? Now, in this row particularly is all the A-list celebrities.
So how many rows from the arena?
There was no row. I'm in the front row. Yeah, so there's no row.
2 fights.
Yeah.
Unbelievable, man.
Listen,
so how much did that ticket would have been?
It was about $8,000 or $9,000. Yeah.
$4,500.
I didn't know this at the time, man. It was not my fault, but it was funny because as I'm walking through to get to my seat, I had to get through Dave Chappelle. I had to get through 2 Chainz, OBJ, right? I had to get through Max Holloway. Oliveira was there.
Yeah.
And then I finally got to like where I was supposed to sit, and guess who was sitting in my seat?
Who?
Dave Chappelle.
In your seat?
In the seat that was supposed to be assigned to me,
wow.
right?
So you talked to him. So you'd be like, hey, this is...
So, no, listen, this is what happened. So I found out that guy that was directing me, the usher, got it wrong. So I knew where I was supposed to sit. I was supposed to sit next to Jolie, right? Dustin's wife.
Okay.
And so they were sitting on like that angle where this is the H and this is the A section.
Right.
But he brought me to the front.
Okay.
So now you have Donald Trump over here, right? MGK and Megan Fox and all the other celebrities, Bieber, and then you have all the other guys here, and then the champions, and then I know Aljamain Sterling.
Right.
So I know Aljo, so we were talking.
Okay.
But I'm sitting there
know him?
just from past fights, and then we also know mutual friends. Like he works with Tony Ricci.
Okay.
So I mean, the guys out at Long Ghost Camp, I know all those guys. So I'm sitting there talking to him, and I'm like, I have no seat. As I have to tell Dave Chappelle that he has to get up because that's supposed to be my seat.
So you were going to your seat and you see Dave Chappelle. You're like,
I was like, what's up, Dave?
Yeah, I think he's gonna win this one.
Yeah, I was like, there's no way they messed this up, right? So, and I know Dave paid for, or if he paid or not, it's still Dave Chappelle, right?
Probably not.
So like, I'm like,
Probably
all right.
Joe Rogan's.
Yeah. So I go back. I'm like, all right, let me just go get some water. So I walked off, I got some water, came back, and the guy goes, "Oh, you're right here." So then it made more sense. I was sitting next to Jolie, and that's where the fight started and everything. But it was a good event, one of the biggest events I've been to. I would say this though. The one thing that I saw that I thought I was gonna be wowed by, just the facade and like just the energy of Conor, right. and I really didn't get that. Nah, I mean,
you feel like the rest of the crowd was though, right?
Probably
different. I mean,
they probably felt that way, but like for me, especially because he's fighting my guy.
I felt it watching on TV.
Yeah,
it's just a different, like, it's like you're almost nervous. It's just like, man, this guy.
Nah, man, because he's just not that guy anymore.
Yeah.
And I felt it, and maybe because he's fighting my guy too as well. I was kind of downplaying it, but it was definitely, obviously huge. But I love the fact that Dustin can take something so grand scale and bring it down to a level of non-importance. So what I mean by that is no nerves, right?
Yeah, no nerves, you think.
What I mean by non-importance, I don't want people to think that, but I would say like, not overthinking it, right? Not letting it get too big for what it is, right. And what it is at the end of the day is a fight. And so he's used to that, you know what I mean? So that was really where I got to see my boy do.
What about all the cameras? That's a little different though, right?
When you do it so much, it becomes second nature.
Right.
And you kind of thrive off of that.
Was this his first time since the COVID? Fighting with the crowd?
No,
Dustin's?
No, Dustin.
What was his last fight?
He fought Conor in the same thing.
Was it with a crowd?
Abu Dhabi, yeah.
Okay.
Yeah, so it wasn't, and it's not the first time that, listen, he's been doing this for a long time, longer than Conor, really, being at the higher level. So I mean, with that, it was more like this is where he's supposed to be, but at the end of the day, he doesn't feed into all the bullshit,
right.
So that was cool, and then the fight started, and then I was like,
so you got there on what day?
I got there on Friday night.
Okay.
So I barely got any sleep.
So obviously Dustin was super busy. Did you get a chance to see him before the fight?
I saw him that Saturday for a second, but it wasn't. I wanted him to kind of relax.
What was he doing?
Nothing, just chilling. Saturday was
in
after
his room, just hanging out.
Yeah, he was actually sleeping actually,
Yeah.
and
So
then
you just stopped by, said hi, and like do your thing.
yeah, and then left. I had some things I had to do. We did some videos, did some YouTube videos. Worked out with Jeff Mayweather, which was cool. I've known Jeff for like 5 years. Went to Flex Lewis's gym, got a training session there. So I mean, I was busy my own self, and you know, but yeah. So you know, after the fight, or actually when the fight was going on, and they started, I was like, you know, I wasn't worried. Like I thought I was gonna be a little bit worried, you know, because I was the first fight. I was a little bit worried.
What's gonna happen?
Yeah, because the first you know 10 minutes is very dangerous when you're talking about Conor. So I was like, all right, but this fight I didn't really get that. Even though like you know he walked out with the Billy strut and all that stuff, like I wasn't really worried about that. I felt like it was a guy that was trying to prove to himself that he still had it, and Dustin was still the same old guy. You know what I mean? So I was, and no disrespect to Conor, like obviously he's done great things in the sport. You know, I'm not saying that, but for me, being biased as a coach, I'm just like, no, I'm not nervous about this one. Even when he jumped the guillotine, like I knew that he didn't have it.
You realized that like how early in the fight?
I mean, it only went for one round. Right. So I mean, but really,
like with a minute in, you're like, okay, I'm good, we're good, or
just throughout the fight, man. Like when he took him down, or like when he jumped the guillotine, and I was like, that was stupid. Like you know what I'm saying? But you're in a fight, I get it. And he thought he had it, you know, but
he probably been training it, you know.
I don't think he was training it. I think it was just there. He thought it was there, and you know, he doesn't have the understand. Like for Dustin to get caught in the thing that he loves to do all the time, it's going to be very hard to do, you know. And also, Dustin's a black belt in jiu-jitsu too, as well. People don't remember. People don't know that, or even if they do, they don't remember.
The last time Dustin did a guillotine.
Subs? No, he does it all. He does it all in practice, though.
He just strikes.
He'll jump the ghillie real quick.
Yeah.
He tries to jump it on me.
Yeah.
Like, get away from my neck.
Does he get it on you?
Man, listen, we're not gonna talk about that.
I'll take that as a yes.
Nah, he's. I guess he spares me.
Does he go arm in or arm out with it?
Yeah, he can get both, man. He can get both. Yeah, that's one thing that he has. If he has a tight squeeze, though.
Does he do the crush? Or does he get more the blood choke or the air choke?
He'll do the blood choke. I mean, he got both, man.
Both,
yeah, it's professional, man.
So it's freaking tight.
Listen, I would say this. He's definitely got a tight squeeze. He's strong in the clinch, man. People don't know that. He's super strong in the clinch. He has like big, like oversized wrists and hands too as well. If you look at like his fists, he's actually got
big hands.
Big hands, big like thick wrists. You know, because he used to be bigger. He used to be like upwards of 200 plus pounds. He was a bigger kid, and then he went down and obviously fought at 145. But yeah, he's always like a bigger, structured guy. You know, but he can get you.
He's a big 155er for you.
He's a big 155er. Yeah, I told Eric, I've been saying this, he could fight at 170, and he probably will. You know, and
I saw someone's calling him out at 170 right now.
Yeah, I know who it is. We will remain nameless. But that's possibility. It's a high possibility. All right, so anyways.
What is 170 or that fight?
Both.
Okay.
And that would be the fight.
That would be very intriguing.
That's the fight to make.
It'd be very intriguing.
Yeah, but we're live, so Dr. Abbasi.
Thanks for having me.
Of course, thanks for coming on.
Of course.
All right, let's talk a little bit about you first, right? Let's go over the bio, right? Let people know who don't know who you are. I know if you guys been seeing me, YouTube channel, all that stuff, you've seen this young man, this handsome man working on my knee and wiggling my leg around like it wasn't shit, right? Right, D? Just wiggling around. Just, hey, this is loose. This is loose, just flapping all around. How'd you get started in obviously doing what you're doing as your career, and how actually did you get started working with MMA fighters too as well?
So to review, I'm an orthopedic surgeon. So I operate, and I'm sports medicine trained. So sports medicine kind of deals with a lot of arthroscopic surgery and dealing with athletes, and then how I got involved with MMA, that's just kind of been an interest of mine in terms of watching it. When I was in high school, I used to wrestle, so I wrestled all 4 years, so I kind of had that grappling background. And then when I first started practicing originally in Houston, I started doing jiu-jitsu as well. So I've done a couple of years of jiu-jitsu under a guy that was in the UFC, so that kind of got me stronger.
Who was that?
It was Alex Morono, who just recently beat Cowboy.
Oh yeah, okay.
So
nice.
he's a great guy. Great.
Yeah, I seen him on your Instagram. That's right.
Yeah, right.
Okay.
Great guy. I've just always enjoyed it. So it's kind of like, you know, birds of a feather flock together. It's like when I came down here, I try to get myself involved, entrenched in MMA, you know, let everybody know who I am and how I can help them, and
Sure. It's
just kind of been fun to take care of some like the best fighters in the world, and obviously hanging with them and hanging with guys like yourself. It's been a blast, and as well I'm also a professional ringside physician as well for common events, so I'll be one of those guys. If it's in Florida, I'm on the Florida Commission, and I would be potentially one of the ringside doctors that would take care of it. So I was like at the first the UFC after the pandemic. I was one of those ringside
Jacksonville,
for
right?
that week. Exactly. Right.
Who was on that card in Jacksonville?
So that week, that was like the Anthony Smith versus
Who's the one?
Texas. He's like
Texas?
42. No, I'm blanking right now.
42.
He's like 42 years old. He's the next in line for the belt. 205. Glover Teixeira. Glover Teixeira. So that
was a good fight.
Yeah, the other main event was that week. There was 3 events that week, and then another one I had that week was Alistair Overeem versus Walt Harris. So yeah. Did you
go in the ring and have to help anybody or?
Yes, there was an arm bar that we were concerned about a elbow dislocation, so I did go in for that. But usually we try not to.
Gotcha.
Usually we try to stay out of it.
So let me ask you this, right? There was a I think it was a while back though, right? It was, I forgot who it was, Macy Barber, and the ACL tear, and the doctor came in and was like,
it
did a quick like check and was like, it's torn, like automatically, and Rogan kind of ripped him.
Right.
Was like, you're not a human.
It's a human MRI.
Yeah. What do you think about that?
Yeah, I mean, it's like when you're a doctor, you're kind of like a detective all the time. So you're like, you go in, and he probably is like, okay, I saw something happen with the knee, and like, as sports medicine docs, that's just the first thing we always do. We'll do a lock. It's called a Lockman exam, where we're trying to pull the tibia forward, and if it goes forward too much, that means there's an ACL tear. So he probably, and actually the best time to check it is right after an injury. Yeah. Right after an injury, before it starts swelling up and they start guarding with the muscle. So he probably got in there. He checked it, and he, I don't know if he's probably not an orthopedic surgeon. Yeah. I mean, we check it every day in the office, but if you're not an orthopedic surgeon,
I think he was like a general practitioner or something like that.
So he probably got excited, and he was, he let the referee know. It's like, oh, it's an ACL tear, and he was right.
Yeah.
He was right.
Yeah. No, that's interesting because obviously you guys have especially.
And did she keep fighting after that when they?
No, it was over. It was over. Yeah. And like you guys have a tough job, especially surgeons, because you're more of a specialist.
Right.
So I remember when I first met you, you came to the gym, and I had that thing lingering for a year. Yeah. I didn't have time really just to be out. And so I asked you.
The ACL tear you're talking about.
Yeah, the ACL.
ACL tear.
Yep. Right. And so I was. Yeah, they know. Okay. There's nothing else wrong with me because I'm just Superman.
You're just perfect. Yeah.
Just kidding. Yeah. But no, like, so with that, I was like, I needed somebody that I trusted, and obviously you work with a lot of athletes now. You work with a lot of fighters too, and that's different. Yeah. Right? Fighters and athletes are way different. What's the difference between you would say a fighter is to just a regular, like let's say a football player or like somebody in the NBA or something like that?
Difference in terms of what? In terms of surgery?
As far as surgery, all that stuff, because I know it plays a big role.
I mean, I would say the sheer toughness of fighters, and then just completely different mentalities. And I'll give you an example. So, let's say in a UFC fight, I mean, it's very common. We'll see someone like break their arm or something like that, like in the first round, or they'll break their hand in the very first round, and it's like, okay, something's not right. They're not using that hand, and they finish off the fight, and they'll use it as like they'll back fist with it, they'll do whatever they can with that, and then. In comparison to that, if someone in the NBA, for example, like twists their ankle, like they're escorted out, to the locker room, we don't see them again the rest of the day. And I'm not saying that's like a bad thing, but I'm just saying look at the complete difference of the mentality and the mindset. A sprained ankle is something that like they won't continue, competing the rest of the day. Yeah. Versus a fighter, they'll literally have a broken bone and continue fighting the rest of the time. Yeah. Face all busted up. I mean, if that happened in the NBA or like MLB or something, like they're done for the day. Just completely different mindset.
For sure.
And what's acceptable, right? Yeah. It's just what we expect, I guess.
Well, if you look at it like this, right? If you break something in a fight, you're still fighting somebody. So
Right.
somebody's out there to physically harm you. So you really have no choice but to continue. Otherwise, you're done. The fight's over, right? So we had that situation happen this weekend. But you know, with the NBA guy or even in the NFL, they have that break in between, or even with the NBA, they have slight breaks, right? It's continuous, but you know, to a degree. And they have that time to kind of recollect, like, okay, I can't continue on. That may also play a role in it too, because you're actually in a cage locked in there. Whereas like in a football game, all right, I need to sub out, right? So, and you have a teammate that can, you know, stay with you.
But you don't often see that. I'm going to sub out in guys in MMA and UFC.
You can't.
It's different mentality.
Well, you absolutely can't.
Different mentality.
Yeah, no, and obviously, MMA, combat sports in general, were more the tougher individuals in general. Like, you know, hockey may be there too as well. I think hockey guys are extremely tough, you know. So when it comes to like injuries that you've seen in the past working with fighters, what are the most common themed injuries?
So I'd say definitely from an MMA perspective or UFC perspective, the most common thing that walks in the door or gives me a call or a text message is definitely the knee injuries. Yeah, for sure. Especially like with the grappling, the twisting, you know, and obviously people know heel hooks and leg locks can obviously damage your knee. But if you're doing a lot of grappling, a lot of wrestling, rolling around, that can sometimes unfortunately cause knee injuries like meniscus tears, ACL tears like yourself, or other ligament tears. Literally last week, pro MMA guy, LCL tear, had to repair that, scope the knee first, and I know you know him.
Yeah. So exactly, so what do you think can be done? I know you can't fully prevent it, but reduce the risk of that injury occurring.
So I would say being very, I guess it's a different mentality. I mean, you know, when I did jiu-jitsu, you know, I'm not a pro fighter, I'm a doctor. So I have very different goals. So I want to go in there and I want to, you know, I want a good workout. I want to learn jiu-jitsu, and most importantly, like, I want to have fun, and I want to like be in the community with other guys, like-minded guys, people, whether it's a doctor or a fighter, a lawyer, whatever. But like when pro MMA guys go, I mean, when you watch those practices, I mean, it's like a complete sprint all the time, and there's big egos involved. Like, you're not going to tap to this guy. Like, I got no problem tapping in practice. I don't care. You know, I'm not a tough guy. But that mentality, and you know, I guess just being careful the way your knees bend and things. If you're in a gi, for example, if it gets stuck in a gi, you notice your finger gets stuck in your knees. It's a good time to take a break and stop. My knees rolled up. That's when you're more at risk of an injury.
Yeah, I mean,
intensity, just the intensity. Like, if you're like super intense,
you're
fighting a takedown, like, and you're hopping on your knee, that's when you're going to see the ACLs blow.
Yeah, no, I get it. And when I was fighting, like, we actually took the jiu-jitsu and like, I barely got in the gi when I was fighting. But if we did ever do gi, that would be a day that would be like our active recovery day, in a sense, right? And a lot of the fighters can understand that, you know, so I think I understand from that perspective. But what do you think about, like, as far as strengthening up tissue, right? So like, let's say, obviously I'm a strength coach, right? So I'm going to strengthen up the surrounding tissue that crosses the joint to allow for more stability, more range of motion. That's where I see, and I'm not going to claim or like, you know, defending what I'm doing for the sport. But I think that's where we come into play more so than anything else as far as performance goes. Would you agree with that?
I would, and I think a lot of, and obviously there's strength involved in that, and strengthening muscles, but I think what gets kind of lost sometimes is how important flexibility is. I think a lot of like hamstring tears or a lot of calf tears and things, or people that have lost some flexibility or not too flexible to begin with. You kind of see these two sometimes varying body types. Like, you got the short, stout, or muscle guys, probably like, you know, kind of like you, and then you got the very lean, skinny guys. Like, this camp is going to be very flexible, but they're probably going to have issues with strength stuff, right? They'll have their own issues. This side is going to have strength. They're going to be very strong, but they're not going to be very flexible. They're going to have their own different issues. So that's when I see patients in the office, you can kind of identify the body type and let them know what they need to work on for that.
Yeah, that makes a lot of sense. I'm glad you pointed out, because that's really what we do when you're talking about like assessing an athlete, right? What do they need? What are they really good at? What their weaknesses are, and then you want to dictate, okay, what's the training progress look like? What's the training program look like to get progress? So before we go on, because this has been something that, you know, everybody's been talking about lately. Saturday night, like we went to the fight, or I went to the fight, Conor McGregor, right? Was it Now, a lot of people have been saying that it was from accumulation of hits and stuff like that. We can go into that.
Right.
It was a tib-fib fracture.
Correct.
It was distal, right?
Distal tib. Distal means farther down towards the foot.
Yep.
So we know. So what we know is, and I actually got a text. I had gotten a text message from TMZ the following day, and they said, "Okay, this is what we know. Can you kind of read this report and just make sure the wording is right?" Like from an orthopedic sense, I've been working with TMZ on some stuff.
Yeah.
And so it was confirmed that he did have a distal tib fib, and that he got a tibial nail. So the tibia is the big weight-bearing bone in the leg, and so that got a nail, which means basically we access the inside of the tibia bone from the knee. We make an incision, we split the patellar tendon usually to access the top of the tibia, and then we line up the fracture, and as it's lined up, we drive a nail down and then put screws below and above the fracture so that fracture can't move either way or rotate. So, and then he also got plate and screws placed on his fibula, and that's the outside bone, the smaller bone. It's not weight-bearing as much as the tibia, but it must have been displaced enough to put plates and screws. Sometimes with that injury Conor had, very similar to probably Chris Weidman, except Chris Weidman's was open, but Chris Weidman only got a tibial nail. He did not need the plate and screws on the fibula.
Oh wow!
So maybe Conor's was. Usually, what we do in surgery is we'll make that decision at the time of the operation. We put the nail in first in the tibia, and then we see how's everything lining up. So maybe they were concerned that the fibula could have still used some help in terms of lining it back up. So we secure it in place with plates and screws.
Gotcha.
In terms of when it happened, so that's kind of like a big controversy if you look at Twitter or Instagram or YouTube. So it's not super clear. It wasn't one thing that did it like Chris Weidman, okay, he kicked, he got blocked right below the knee, shattered his leg, but done. With Conor, there wasn't anything super obvious, At first they thought there was one kick that maybe Dustin checked on his knee, but that looks like Conor hit him with his foot, not so much his shin. So I don't think the energy would have transferred up towards that. And then you see other people showing clips of, there was one instance where he looks like he kicked and landed on the outside of Dustin's thigh. Yeah. And it just looked very awkward after that.
Yeah, that looked like it was already broke at that point.
Potentially.
Yeah.
And then the last thing is they talk about he tried kicking Dustin, and Dustin
blocked it with the elbow.
Blocked it with his elbow, and that's what I think his coach
Kavanaugh
mentioned that. But none of them I would say are the most routine, I guess the most what we would expect to cause that. So maybe there was an accumulation of all three. I don't know if it's super clear. Yeah,
it was kind of weird because when I was seeing it, because where I was situated, I couldn't really see anything because of the post.
Right.
It looked like, to me, from my point of view, it looked like Dustin hit him with the straight left and he fell down. Yeah. But I saw in the replay it slipped and then he went back and then he just crumbled.
Yeah, it was.
I don't know because I didn't really see him check the kick from anywhere below the knee. I know that he did. I know he caught the elbow. Right. But I don't know if that was the main cause. But then you look at the footage of him kicking the back of the leg and it almost wrapping around his leg so awkwardly. And that's exactly when it went back, and then that's when it rolled on him. But what do you think is the road to recovery now for him?
So when we stabilize it with the nail, usually the advantage of that is as long as we can align the bones in a good position and fix it in a good position, that nail is holding everything in place. It shouldn't move anymore. So usually right after that operation, after we nail somebody, and then plus the plate and screws in Conor's case, I usually will allow, and most doctors will allow them to start walking on it immediately. So you have the ability to start walking on it immediately, start bearing weight on it. And so the physical therapy starts usually in the hospital. You get a couple sessions in, and then we try to get you ready and then send you home, and then that physical therapy outpatient-wise starts. And I think I saw something that Conor said he's going to, need crutches for 6 weeks. So 6 weeks typically is, that's the number we use for bone healing time. Oh, okay, yeah. Now, if he can get off crutches before that, it shouldn't really matter if the bone is healed or not, because it's stable. It's stable. So that's the advantage of putting these nails in, is they're on the inside of the bone. So the bones are actually not solid; they're actually hollow on the inside. That's where your bone marrow gets made. So it's not like they're clearing stuff out to put it in. So you can put a nail on the inside, and then it should be stable right away. So even before the bone is biologically healed in 6 weeks, he should be able to start walking
on it.
Yeah.
When do you think he'll be able to train on it?
So I would say we want to get past that 6 weeks. Obviously, the doctors are going to take follow-up X-rays. We want to start seeing that tibia fracture, kind of what we call callus, or basically bone forming between the two bone ends. But like I don't know how far Chris Weidman is out now, but hasn't he like posted stuff like he's doing some like boxing drills and stuff?
I mean, he started walking a month ago, I believe. So I mean, now he's doing more drills and training.
So I would say, I mean, very realistically, at 2 months, 3 months, we might see him start doing some types of drills. I think within total timeline, and I'm trying to be conservative, it's very doable, very realistic that he could fight again in MMA physically, from a physical standpoint, within a year. Now, if he can do it mentally, that's a different question.
Yeah, it's possible, man. There's so many options right now. With Dustin, I know he wants to fight Dustin next, no matter what. But he's got Nate there.
Right.
Obviously he could take his shot with like Jake Paul. There's so many different options nowadays. The thing that we're looking at, like from the camp, that obviously Dustin's camp is like, all right, now, do we go for the title, or do we go again for a fourth fight? Both of those are there.
He would think about doing next, potentially, because it's going to be probably a year.
Not sure, man. He definitely likes to take a couple of months off and really just basically decompress and do his thing. And I'll call him later this week. I'm probably gonna leave him alone. And usually he calls me first before I actually call him, because he's ready to go. But yeah, we'll see how it goes. I mean, but it's an unfortunate thing, but like I said, looking at it from the fight itself, I really see it not going any other way but Dustin's way. But we'll see. The fourth fight, he can make some money doing that. I'm down, obviously, and whatever. But so I want to kind of backtrack a little bit. And so you started, obviously you got your degree, you went through all the doctor stuff. Was it 7 years?
So high school 4, college 4, med school 4, orthopedic surgery 5, sports medicine 1. I graduated the 26th grade.
The 26th,
But I'm
a lot of school.
I'm always learning.
Nah, for sure, 100%. So when you were doing that, were you watching like fights and stuff? Or you were actively in it?
Fights, So I was the guy that would go to Blockbuster and I would get like UFC 1.
Oh, nice.
That was that guy.
That's cool.
Yeah.
So all right. So now, getting here, because you moved to Florida.
You don't know what Blockbuster is anymore?
I don't probably. Nah, Blockbuster used to be a store where you actually went and bought or rented videos. Yeah, Netflix killed that thing. It's over. You're showing your age, by the way. Anyways, so when you moved to Florida, how'd you get hooked up with all the guys at Sanford?
So I walked in there. I walked in there one day and introduced myself to Henry Hooft. And I said, this is who I am. This is what I do. And I'm here for you guys as a resource if you can use me. And then, I would pop in once a month or something like that. And then, you get to talking to guys. And then, and now I'd say I'm like friends with a bunch. Like for UFC 264, I was at a Sanford fighter's house, watching the fights. Yeah,
that's cool.
And then if you do good work, if you're treat people well, then it just then you get on like these text. I guess you get on these text chains. So like literally one day I got out of the call to the blue. I got a text message on my phone. It's like, "Hi doctor, this is Vitor Belfort. I heard good things about you." I went out, I'm like, "Okay,
that's cool."
So then I talked to him. I'm like, "So just out of curiosity, like, how did you find my number?" And it's like. He's like, oh, I got it from Gilbert Burns. I'm like,
that's cool.
Okay. I was like, I didn't know Gilbert had my number. So then I saw Gilbert like a week later. I'm like, hey, just out of curiosity, like, how did you get my number? And he was like, oh, I got it from Jared Gordon. Okay.
Nice.
Like, this is a good thing.
That's the circle, right?
That's right.
That's what usually happens, man. And a lot of coaches ask me that, like, how do you get hooked up in these circles of guys? Man, it's just literally just getting yourself out there, going to the gyms and introducing yourself, and then being successful and doing well and being able to communicate with these guys. And if they like you, then that's what it is,
So Vitor called me last night. He actually gave me homework to do.
Oh yeah.
So he said.
Gave you the movement homework.
He's like, what do you think of what do you think of that fight? What that leg break and stuff. He's like, why do you think it's happening? He's like, He's like, we got to figure out why this is happening. So you need to research this.
Yeah.
Research this. And I'm like, okay. I was like, okay, I like that.
Yeah.
Vitor Belfort's giving me homework.
What? You know what? That's a good actually question that I wanted to ask. Why do you think this is happening?
Okay, so the ones that keep coming, reference that very recent on everybody's mind, obviously Conor, going back to Chris Weidman very recently, and then before that we had Anderson Silva. I'd say those are the most commonly referenced ones. I would say in general, would you agree, and you know the MMA side more than me as a previous fighter, I would say, would you say when you watch contests or you watch fights now, the leg kick is definitely becoming more of a weapon that people utilize? Would you not?
The lower leg kicks, leg kicks, definitely the calf kicks, what people say.
Calf kicks, right?
That's a definite weapon now.
Correct. Like Chito Vera versus Sugar Sean O'Malley, right? When that happened.
Yeah.
And like obviously Barboza is a killer with that.
Yeah, yeah.
So I'd say maybe we've been seeing it more and more and more. So as a counter to that, I think people probably have been learning how to defend it more, right? So checking the kicks. And so for like in Chris Weidman's example, for Chris Weidman, when he broke, for example, perfectly checked kick by Uriah Hall. Yeah. Right? Yeah. So if you're going to slam your shin against someone's tibial plateau, which is right below the knee, it's extremely hard bone, and you're not going to get the better of that exchange. So I think part of it is the way that the evolving of how leg kicks have been being used. No, guys have to counter it now, so they know how to check it better. So now you're going to take some damage.
Yeah, it's interesting.
In Conor's case, it wasn't like a clear thing though. So I mean, Anderson Silva's was checked by Chris Weidman, correct? And then Chris Weidman's was checked by Uriah Hall. So I think it's the checking there, and with Conor's it wasn't as obvious, but.
Yeah, it was kind of a freak accident, but like I said, I like to see him. He'll probably fight him again, but yeah, definitely weird. People
have been asking me online. They're like, maybe fighters should be getting bone scans or bone density before tests.
So let me tell you this, right? We've run tests on them, right? We've run tests on multiple fighters, over at NSU. Me and Corey Peacock works with all the Sanford MMA guys, most of them. If you take a look at MMA fighters, and they've done the research and studies on this. Fighters and NFL players have the highest bone density out of any athlete.
Exactly. That's what I tell people. If you see somebody and they look like they're sculpted, like their physique, like Conor McGregor, like fantastic build, right, muscle definition, they're not going to have low bone density. You can't have low bone density with that muscle mass.
People ask me, how can I prevent that, like as a strength coach? And I'm like, well, I mean, you're kind of doing what you can do.
Like fractures?
Just strengthen up the bones. And like, obviously, building the muscle, you're going to get more calcium building. But like at that time, like you can only do so much. Right. And that's a lot of force being driven into a sustainable object, like a mass object.
You're slamming bones against each other.
Something's gonna go wrong. So I mean, it's a sport. It is what it is. People are like, oh, should they use shin guards and all this? And I'm like, it's never gonna happen. You're never gonna have shin guards in professional MMA.
But I mean, you could say they wear gloves.
They wear gloves, but it's protect the hand primarily, but they're not like, they're obviously thin, right? But the problem there is that when you got shin guards on, it's extremely difficult to grapple. Right. Like shin guards, they make it's a hassle to grapple with. It's hard to kind of move a little bit more, and especially if you're trying to do takedowns and everything else.
I get it.
You got pancration, like all that stuff. Yeah. That they did it there, but that was, and they also wore shoes too as well. So, I mean, I don't know. I don't think you'll ever see it.
I got homework to do.
Yes, you do got homework.
You
got to do it.
Look into that.
You got to do it. Now, you go back and forth with Chael Sonnen a lot too as well. Yeah. How was that?
Yeah. Oh, it's great. I mean, I think Chael. So I've never met him in person, but we're like Twitter friends, so we met direct message a lot and stuff. And he's been very supportive. I think he likes my breakdowns. He references them, which I appreciate the support. Yeah. I think Chael Sonnen is one of the smartest guys. Yeah. I think he's just so smart.
Yeah. How in such ways though?
I mean, obviously, his analysis is great, but just the way, I mean, you can tell he's a very good businessman. Yeah. He's just, I just think, you can just, if you watch his YouTube videos, I enjoy watching his YouTube videos. Sure. He's well versed in a lot of different things. He likes delving into the medical side with me, but he's also he also will ask me questions about crypto. You know? So we're talking about crypto.
Yeah. Well versed individual.
Very well versed.
Yeah, that makes sense.
You can tell he's a businessman.
For sure.
Well, he's got his own show on ESPN.
Nice. Yeah.
Twice a week, Mondays and Wednesdays. That's the Chael Sonnen Show.
Yeah, that's cool. It's a good person to know. You know what I'm saying? That's good.
Yeah.
So, all right. So now, with that, we talked about the knee, we talked about the lower legs, but what about like the shoulders and the neck, and even you know with the skull? What about that? Like as far as, because I know that you just worked on my mother-in-law, right? She had a rotator cuff tear. Right. I know that that's actually harder to recover from than the actual knee because of range of motion, because of the ball and socket.
So the knee in general pretty much just flexes and extends. I mean, it can do, there's some rotation, you know, there's called a screw home mechanism where it does a little bit of rotation. But if we just want to dumb it down, it extends and it flexes.
It's a hinge joint.
For the most part, it's a hinge joint. It does do some other stuff, but we'll just say it's a hinge joint. So really So basic principles after any surgery, whether it's the knee or whether it's the shoulder or any body part, first you have to regain range of motion. You want to regain full, painless range of motion if possible. Once you get the range of motion, then you can start working on strength. So very basic principle, anybody can remember that you're good. Think about how easy it is to regain a motion in a knee that just flexes and extends. Okay, the shoulder. So the knee is a hinge joint versus the shoulder is a ball and socket joint. So a ball and socket joint, it rotates, it flexes, it adducts this way, it goes that way, and it's just got so much range of motion. Yeah. And so, people. I mean, not my patients, but some patients, they say, after rotator cuff repair, it's one of the toughest recoveries. Yeah. But that's probably what it is. It's just a harder joint to reach.
Yeah, I can imagine, because now you have to get range of motion, basically all through these ranges, flexion, extension, rotation, all that. And for that, so what's the recovery process look like? How long?
After a rotator cuff or like a labral repair?
Yeah, labrum, everything.
So I'm very concerned. So I would say in terms of surgery in general, after a surgery, arthroscopic knee surgery, the knee can get stiff fast. It can get very stiff. So I'm very aggressive with physical therapy. I want you in physical therapy 2 days after surgery, if at all possible. With a shoulder, for the most part, they just don't get as stiff. So I'm very conservative with the shoulder. So I usually don't want you starting physical therapy for 2 or 3 weeks.
Oh, wow. No.
Because I just want everything to scar in. And some guys may think that's too conservative, but it's done well for me. Yeah. But typically after a big repair, rotator cuff repair or labral repair, I usually have you in a sling somewhere between 4 to 6 weeks. And I don't want you doing too much, depending on the size of the...
Now, with that, though, are they doing any, isometric grip work or anything like that in the sling?
So, if you're doing... So, after shoulder surgery, I got no issues with any elbow motion. You can do elbow, you can do wrist, you can do hand.
Yeah, you can do some rotation, right?
It's just I don't want you doing this.
Gotcha.
I don't want you doing this because you're ripping... You're tensioning the repair that we just did.
Yeah.
So...
Gotcha. Yeah, that makes sense. So, all right. Now, with the shoulder, with the knee, what about the hip? Now, the hip, Dustin's obviously had hip issues before. He had a hip resurfacing. I had another individual, King Mo the Wall. He had crazy hips.
So he probably had FAI or femoral acetabular impingement?
He had an impingement. He had an impingement, but he also had, there was some we're talking about Dustin's fraying of the labrum, which ended up over years. This is talking about 10 years of...
A lot of people have that on an MRI. Okay. You might have it on your MRI.
Possibly, yes.
So we may get MRI your hip, and it may show you have femoral acetabular impingement and you have labral tears. Okay. It's a common finding, but the question is, does it cause pain? And for him, obviously, it did.
Definitely.
But a lot of people have...
And range of motion, though. And range of motion issues.
Okay. And is his range of motion better?
Better now after the surfacing and resurfacing.
Does it feel significantly better?
Significantly. It still has some pain every now and again. Always have to ask him how his hip's doing. And we had limited range of motion. We're talking about the first, 5 years I worked with him, 4.5 years, where we couldn't do a full depth squat.
Was it just one side or both?
It was one, but it also, it messed up his other side, obviously.
So his other side didn't have any of these issues? Or they had never looked at it because he had no problem?
When he couldn't get down in those ranges anymore, he just lacked the mobility at that point. Right. So then there was a huge discrepancy. So then he would have these asymmetries built in where he had a large amount, which is crazy, he has a large amount of hip flexion, Like he can,
which is not common. FAI for his problem.
So I would say this: I don't think it was hip flexion, because if you do a test on him, but he does have a lot of lumbar flexion. Okay. So I think he was compensating there, because he can kick his leg up like to his face.
Yeah.
You know, so he has like, I think he has a super mobile spine, which is significant, because at the end of the day, he's never had any spine problems, he had any back problems.
That's good.
But the hip didn't allow him to get into ranges like, you know, deep hinging or deep squatting. Lateral movement was limited. So you look at like the Gagey fight where he was getting his leg kicked off, like but you know, obviously won the fight, finished him up.
Yeah.
But the reason why he was getting kicked so much was because he really lacked that ability to move, right? To like angle out, because he can't angle out back then. Now he can, and so that's why that's how we've been working on that lateral movement, that change of direction. Yeah. Before that, though, very limited with that range.
Yeah. So he's happy after his hip surgery. He's happy with it. It's done well.
He went to a specialist in San Francisco. Okay. They did this resurfacing. They also put stem cell in there. Yeah. And I think they hit him with some PRP. Yeah. You know, but yeah, he feels good. It's still an issue. Like, and we're talking about a kid that, even though it was hurting like that, he would run 6 miles a day. Yeah. You know what I mean? Right. So
yeah, I mean, look what you guys do.
Yeah, I mean, it's amazing to me.
Everyone's got a little bit of something. It's his hip, it's his elbow, it's his shoulder.
Yeah,
you know, everyone's got a little bit of something in MMA.
Yeah, no, that's true. And in any combat sport, really, that's the true. Like for me, that's the biggest hurdle. Like that's the biggest obstacle to go over, is like there's so many injuries in the sport. You have to work around those injuries until you have the opportunity to get those injuries fixed. Right. And then you can rebuild from there. Yeah. And that's where you come in, right? Yeah. So like if I had a guy, let's say I had like King Mo, right? He had that hip resurfacing, he had the impingement, he had some
Now when you say hip resurfacing, are we talking about like he had like a partial hip replacement? Because there's partial hip replacement where you actually shave off the bone, or was it just arthroscopic?
No, it was a shave off the bone. It looks like
opened them up, and they put like a metal thing.
It looked like a doorknob.
Dustin has that?
No. Okay. Dustin doesn't have that. King Mo does.
Okay.
But Dustin may be on the way to getting that, right?
Yes.
Overall, right when he retires, he can't fight like that.
I wouldn't. You're probably not advised to go back to fighting after partial hip.
If you have a hip replacement, it's over. Like that's what they were saying.
Much.
It's over.
Like Ben Askren just boxed with one, but yeah.
You should see my face when he said that. Did he really box? I don't remember.
On paper,
on paper, yeah.
Box,
on paper, he fell on his face. I remember that one. He got in there. What? Cut.
I shouldn't have said that.
My bad. Yeah. Listen, I like Ben Askren.
Yeah.
I think Tyron's gonna beat Jake Paul. By the way.
It's intriguing.
It's intriguing. Look, T Wood's my dog, man.
Yeah.
He gonna bang him.
He gonna bang him up.
Yeah.
He gonna bang him up. I said it first.
I don't think Jake is a slouch.
No, exactly.
No, listen.
That's why you can't say, oh, he's gonna kill him. You can't say that.
So like, I've been there. I met Jake Paul and Logan Paul. I worked with Logan Paul one time, and the kids, they're cool. Like,
where'd you work out with them?
With Logan?
Yeah.
I went to his house in California. It was like a mansion in California.
Where, LA or something?
Yeah, it's like LA area. But
didn't he move? He's going to Puerto Rico. Right?
I have no idea, bro. I don't follow these kids.
I know more of this than you? What's going on?
Yeah, bro. I'm not into it like that. Listen, they call me, I go, that's it.
Okay.
Pay me and I'm good.
Okay. So how long did you work with him for?
I just worked for him that day.
Okay.
Give him some pointers and tips.
Yeah.
Because I wasn't going to be able to work with him consistently. He was in California, but I was out there anyway, so we stopped by. But I mean, Logan is definitely, they're both into it. Like they definitely want to be pros. Definitely. They want to be treated like such. Logan or Jake does have some skill. Like he sparred a couple of my guys, or I went to the gym and watched him spar.
I stitched one of their lips up. I know this.
Oh yeah. Yep.
I know this.
Damn. That's crazy.
You know what I'm talking about? Right?
Oh, I know who you're talking about. Don't worry, I was there.
Oh, you were?
I was there. I was there at the sparring match.
Yeah, so we won't say his name, I guess, but I mean, he was sparring Jake Paul, and he took one right in the chin or the lower lip, and he went he lowered his lip down.
Yeah.
His lip was completely detached. I mean, it was completely detached.
I don't know how that happened.
So he gives me a call, and I'm an orthopedic surgeon. I don't do that stuff. So he's like, I was like, send me the pictures. He's like, can you help me? I'm like, come on, that's like the MMA doc life.
Yeah, no, it is.
Like,
well, that's the point. So now that you're in the circle, like, you're gonna get
a little bit of everything.
Yeah, you're gonna get a lot of shit. I got pneumonia, doc. Can you help me?
I've already got that.
Yeah, I'm sure.
Yeah.
Yeah. So
it's always on the weekend when they say this.
Yeah,
it's always on the weekend.
Exactly. Yeah. So but I think it'll be a good fight. I talked to Jeff Mayweather about this too, and it's funny because Jeff kicks it real. Like,
he's training. Are they training Tyrone?
Nah. Floyd, went there.
He's with Floyd.
Yeah, Jeff does his own thing, but they work together. But I think that the problem there that you have is that, T Wood isn't a boxer, right? But he's a knockout artist.
But he's got power for sure.
He's got power. Yeah. He's an athlete. He's 100% an athlete. One of the best athletes I've ever trained. But what I will say is this: is that Jake has been consistently boxing now, longer than T Wood's been boxing, even though. And
he's an athlete. I would say he's athletic, right?
Jake is athletic.
He's not world caliber like Tyrone.
Listen, I think if Tyrone went the different route and went, and played football, he'd probably be in the NFL, like type of stuff like that. I would say him, and there's two other individuals that I could say that could do that I've trained in the UFC. One was Will Brooks for sure. I think Will Brooks can definitely go, and then what's his name? Walt Harris. Walt Harris could definitely go. I seen Walt Harris jump on a 61-inch box at 260 pounds.
Yeah, definitely. I mean, definitely Walt Harris. I mean, he's got a different physique than those other guys.
Yeah, but he's extremely athletically built, and he's big.
He's huge, which helps in the NFL.
And he played basketball, so that does help. But getting back to that, I think that if it goes to where T Wood can pressure him and then just hit him with one good shot, man, and he's gonna crumble him because he still has the power. I think with the UFC, he wasn't all in there. He wanted to do other things, but that now being it so hyped up, he doesn't like Jake at all, and also he's gonna get paid. So I mean, it's good for him no matter what. Is there some
revenge factor with Ben? Because
I don't think it's a revenge thing. I don't think it's a revenge thing. I think it's more of like he's putting up for everybody that Jake's been talking shit for.
Are you so close with Tyrone?
Yeah.
So what's he doing now? Like after this boxing match, what's his plan?
I have no idea.
Does he want to fight? Does he want to consider different promotions? Does he want to box?
I would like for him. Seriously. I would like for him. I would like for him to go the route that I know that he would like to go, I believe, and that's going to be more entertainment.
Okay.
So
like in what sense? Like
acting, probably. Okay. Acting. I mean, that he's close with Dean Thomas, and Dean's been a coach of mine forever.
Right.
And those two guys have the ability to transition well into entertainment, which obviously Dean's doing it now with ESPN and doing it with the UFC, and he's also comic. People don't know that, or he does he does improv, and then Tyron's got that look, so he can play in these roles if he needs to, and that's going to help him kind of pivot out of fighting.
He kind of has the same look as you right now, right?
What? Tyron?
The short hair and the beard.
Damn. Okay. I'm the white Tyron Woodley now. We can quote this on a meme.
Same physique, right?
Yeah. No, we're definitely the same size. Yeah. He's same height, same build.
Same beard.
Same beard. Yeah. But I've seen him since I've known him since because he's worked with Dean for so long. I've known him for like 10 years. And I've recently worked with him a couple times and worked with him when he was fighting in the UFC. But yeah, just overall, I like him a lot. You know what I'm saying? So I hope he does win.
Yeah.
But it'll be a good fight. And then you have, a couple other matches coming up. But I think.
Where's Jake Paul training right now? Is he in South Florida?
He's in Miami.
He's in Miami.
Yeah. So they're both fighting. They're both training in Miami.
Oh, really?
Yeah, and the fight's in Ohio. So and Ohio is their home state. The Paul brothers.
Okay.
From what I heard.
Okay.
So we'll see, but yeah, there's a couple of big fights coming up. Who do you like on the? Who we got? Who's next up? There's.
Yeah, who's the main event this coming week?
I want to say.
I'm so happy when there's a UFC on a weekend. It's just not the same. It's not the same without it.
Without it on it?
No.
There should be a UFC fight every damn weekend, but but
I don't know. It's not the main event, but Miesha Tate's coming back this weekend.
I don't know how I feel about that. I think that's kind of over. I think it's not going to look too well. Listen, it's a different level now of female fighting, right? Back when she was dominant, was like, okay, with Ronda Rousey and Miesha Tate, look, and then a girl named Amanda Nunes came on and just trashed them all, right? And now you're seeing those types of athletes, those types of female fighters in all weight classes. There's an Amanda Nunes in every weight class now, right?
Is there?
There is. And what I mean by that is you're looking at very dominant, very well-rounded girl fighters, female fighters. Now you're going to have to look at super fights between those two, right? You have, with Amanda and you have Shevchenko, right? Those could be another super fight, even though they fought before. But I think that Shevchenko is definitely
very dominant.
She's definitely gotten better.
Great to watch.
She's gotten better, and now it's a crazy fight there. I mean, look at even with Rose. Look at the progression of Rose since the start. You know what I'm saying? Where she had some holes, now she doesn't. And with that, that's a credit to her coaching. That's a credit to her work ethic. So I think the female fighters in general, they made a tremendous leap in talent and just ability. Miesha Tate comes back, and who's she really going to fight? That's really, you know what I mean? Yeah. But at the end of the day, it's good for business, I guess, But yeah, there's a lot of good things going on.
I think she'd want to consider coming back if she didn't think she had, something to show.
Listen, all fighters think they still have it. Okay. They all have one more fight left in them.
Yeah.
But not necessarily, it's not to the degree of where they actually are true. Right? So then that's where, like, I hate to say it, but the closest people in that camp, or the closest people to her, need to have a real one-on-one conversation with that individual, or whoever it is that wants to come back when they're not really ready to do that. And the worst thing you want to see is a person that has developed and strengthened their legacy based off of their wins and what they've accomplished in the sport, and come back and look 50% of what they were before. Right. You know what I mean? So that's why I always tell the fighters that, and look at Khabib did the perfect route. He basically retired on top. No blemishes. Right. Can never say that guy wasn't the best ever, because he went through the entire roster, right?
Yeah.
And you can say, he could come back.
No way he'll ever get back down to 155.
I mean, yeah, he's big.
Humongous.
He's big, but no, you could always diet and get back there. I don't think that. I can get to 155 if I really wanted to. Like, if I really wanted to, I'd diet and go back down there. But it's not that. It's more so of like, do I really need to? Do I really want to? Do I really want to kill my body? Put my body in this position for 12 to 8 weeks and then fight and then prove what? You know what I'm saying? At the end of it all, it's always a then what? Then what? Then what?
Why do you think Conor? What motivates Conor then? I mean, he's got all the
Conor
money in the world.
Conor needs self-motivation, because he still feels irrelevant. Or when you start feeling irrelevant, right, then you need to go back into the thing that got you where you were.
He's got the itch to be in the lights.
You have to be, because that's what he lives off of. That's what he breathes off of. But, if you can't pivot in your own way, like you try to, you go to boxing and the boxing didn't really work out, or you go and do something else. But, like, what is he really known for? He's known for being a UFC fighter. Right. So, and then from that, I think the good guy act, and I don't know if it's an act or whatever, and I don't want to talk bad about him, but I'm looking at it from the person, right? And I know fighters, and I would say that, and I know athletes at the highest level, when they feel a sense of that's what they can identify themselves with, if they don't have that, they are lost.
The identity's gone.
That's an identity crisis.
Right.
And for that, now what do? So now he has to find a way to get back to that old self. So that's why he went back to the old Conor McGregor. And it's funny, evil Conor, whatever. Yeah. It's the old Conor. Like that's honestly who he was. Yeah. If you look at it like with the Jose Aldo and all that shit, like it's the same person that he was. Yeah. Now it's just kind of now he's fighting a guy that everybody likes. Right. So now he's like, he's an asshole, right? Yeah.
I like. What do you think about him getting back to the evil Conor or the? I'll say this. I don't like the family comments. Mm-hmm. With us, I don't think that there's no call for that. But I kind of like the mean Conor.
You like him because you're a fan.
I just think
it
just wasn't the same when it was nice Conor. Like the world, like the UFC is a better place when there's evil Conor, and it's just more entertainment. But I don't like stepping into the family.
Look what but you're talking about it from a fan's perspective. 100%.
But
Because
also
people
his
want
own
that.
bravado, like, okay, he's feeling the vibes again. He's getting back to his old self.
That's fine.
This is what he was, this
That's
is where
fine.
he's coming from before.
Doesn't mean that he's going to be able to win fights, though.
Right.
Right?
But
And
it
you
was a
can
good
only go so
sign.
far.
It was a good sign until obviously what happened.
Yeah, but you can only go so far with that before
Yeah.
you start to you have an overanalyzation of yourself,
Right.
and then the ego starts taking
Maybe
over.
he was forcing it.
Yeah,
Maybe he was forcing
yeah.
it. Yeah.
Well, he
And
has-
I didn't like the family. I don't
Listen,
think there's any place for that stuff.
There's a level of narcissism that you don't want to cross over, and that deep narcissist that he has, that he cannot get back to wherever he needs to be
Right.
to level himself out.
Right.
You go overboard because now you play that character up because everybody's looking at you as that character.
Right.
Well, now you're like, well, shit, I'm gonna be that guy to the 10th degree because now everybody's looking at me because that's who I need to be.
That's who you're
Right?
It's his brand. It's
Now I'm the bad guy. Okay, you guys are
Yeah,
gonna see the
yeah,
bad
yeah.
guy, and now I'm gonna take it another level.
Right.
And so when you get, and then you throw anger,
Yeah.
you throw resentment, you throw like frustration on top of that.
Right.
Now I'm gonna talk about your family. Now I'm
Yeah.
gonna do this. Now I'm
Yeah, I
gonna
didn't
really look
that.
like an asshole.
Yeah, I didn't like that.
But that's not good. That doesn't show virtue,
No.
right? That doesn't show
Right.
you as a stand-up athlete, right? And you're showcasing that as people, young kids. I was on a plane with a kid that was going to his first UFC event. He's 14 years old with his mother, right? And he was so excited. He's like, I want Dustin to win, and I was like, well, what do you think about Conor? He's like, I don't know. I mean, I like him. I like his style, and of course, like, credit to his parents for showing him that that's not the way you need to conduct yourself.
Right.
But this kid's going to a first UFC event, and now he has to see a guy trash talking another guy's wife inside a cage.
Right.
You know what I'm saying?
Yeah.
And talking about him, his wife DMing him. Come on now.
Yeah.
So like that doesn't show positivity. That doesn't show
no, I think
virtue.
that crossed the line, but I will say, I kind of like the
WWE style.
I like cocky Conor. I didn't like the nice Conor.
Sure.
Just wasn't the same.
And there's a level to it. There's a level of like where you don't cross.
Yeah,
and
I
you
miss
cross
like
it.
the old press conference Conor. You're like throwing jabs
Sure,
at
that's
Aldo
funny.
and like Mayweather.
That's-
like that's what we want. That's what we want to see.
It's funny until it gets to a point. Yeah, until it gets to a point. Listen to me. Until it gets to a point where you get a guy like Habib who jumps over the cage and starts a melee because you just disrespected his whole country and his religion.
Yeah,
Right?
You don't have to do that to be.
You get dealt with
to be
like
the
that.
persona, right?
Gang. All right, Doc. Thanks for coming on the show.
Okay.
Let them know where they can find you.
Right.
Twitter's blowing up now too, isn't it? Twitter's
okay,
doing
so
good.
you can
Instagram.
check me out, you can check me out on. I got a YouTube channel where I go over injury breakdown. So. And it's mostly focused on MMA and UFC. So if there's an injury or you want to see what's going on, if you want to kind of see the sports medicine aspect of it, you can check me on YouTube.
Mm-hmm.
I'm also on Instagram. I'm on Twitter. I'm on LinkedIn for professionals. And I'm also on TikTok now.
Oh yeah, that's it.
Also
Well, what's the
TikTok.
name, bro? They gotta find you. How do they
Dr.
find
David
you?
Abbasi. So
Jeez.
just put that on the bottom.
David Abbasi. Dr.
Abbasi.
David Abbasi.
ABBASI.
ASI. Boom, right there. All right, guys. Thanks again for watching. See you again next time.